This video will show you the correct procedure for changing the dressing on a PICC line. Complete hand hygiene. Wash hands thoroughly using soap and water for at least 20 seconds, or apply hand sanitizer and rub hands together until dry. Gather your supplies. You will need a central line dressing care kit, an extension set, and a saline syringe for priming the extension and flushing. Clean the surface of the workspace with disinfectant wipes or soap and water to prepare. If possible, position the patient at a table sitting upright with their PICC line arm resting on the tabletop. The nurse should sit next to the patient, closest to the arm with the PICC line to make the dressing easier to visualize and reach, rather than working on a sofa or recliner. Set up your supplies on the clean surface. First, open the Central Line Care Dressing Kit. The first set of gloves are considered clean, not sterile. They are used to remove the old dressing. You will also find a trash bag and 2 masks. One mask is for the patient, and the other is for the nurse. Both the patient and the nurse should wear a mask to prevent contamination of the site while the dressing is being changed. If the patient refuses to wear the mask, have them turn their head away from the insertion site. Perform hand hygiene. Apply the first set of gloves. Place the drape under the patient's arm with the shiny side down. Open the adhesive remover and apply under the edges of the old dressing to help release the adhesive. Remove the dressing low and slow. Continue applying the adhesive remover under the dressing to avoid a skin tear. If the patient is a child or has thin skin, you may consider using adhesive spray remover. Be very careful not to pull on the line while removing the dressing. If the biopatch slit isn't parallel with the line, it can pull on the line. Anchor the line with your pointer and middle finger at the bottom of the dressing, and move them up toward the securement device, holding the line as you gently pull the dressing off. After the transparent dressing is removed, open the Velcro flap and carefully remove the securement device from the skin with the wings attached. Then carefully remove the wings of the catheter from the securement device. Use an alcohol wipe to loosen. Discard the old securement device. Remove your gloves and complete hand hygiene with hand sanitizer. Open up the second layer of the dressing kit. This layer is sterile. These supplies include walleted sterile gloves, a transparent dressing, a securement device, a chlorhexidine swab, the skin prep, a biopatch, measuring tape, and 2 sterile gauze sponges. If you are using any specialized dressings or supplies not included in the kit, add them now. If the patient is sensitive or allergic to chlorhexidine, you will need to add an alternative patch, such as Algidex, as well as betadine and alcohol swabs, to the workspace without contaminating the sterile field. To prepare the betadine and alcohol, tear the tops of both packets and push the swab sticks up, so the 3 sticks are easy to grab with sterile gloves. Add the alternative alginate disc to the sterile field by opening and dropping the disc onto the sterile field. Complete hand hygiene with hand sanitizer. Apply your sterile gloves. Use the gauze sponge to grasp the line to keep it sterile while you carefully lift it to avoid migration of the tubing. Crack the chlorhexidine swab to release the liquid into the sponge. Clean with chlorhexidine in a hashtag pattern for 30 seconds. Scrub off all adhesive. Be sure to remove any dried blood or scab from the insertion site, as this material can feed and promote bacteria growth. Let dry for 3 minutes. If alcohol and betadine are used, use one of the sterile gauze sponges to grasp the non-sterile outer swab packets and keep your gloves sterile as you remove the swabs. Apply alcohol first in a hashtag pattern for 1 minute. Let air dry. Then apply the betadine in concentric circles starting from the PICC insertion site, moving outward. Let the betadine completely dry. The skin will be orange. Let it dry for at least 3 minutes. With either process, it is critical that the skin is dry before applying the dressing. If the skin is not dry and the dressing is applied, it can create a chemical burn causing skin breakdown. Never apply the dressing to wet skin. Also, do not stretch the dressing when applying it to the skin. Next, apply the skin prep to the skin where the dressing will touch, avoiding the insertion site under the BioPatch or Algidex patch. Skin prep creates a plastic-like barrier on the skin to protect it from moisture. It is an important step to protect the skin. If your patient declines this step, educate them on the benefits of using skin prep. Next, take the securement device from the sterile field. First, open the Velcro door and remove the paper to expose the adhesive area. Using the sterile sponge to maneuver the PICC line, attach the wings of the PICC line by laying them on the securement device, with half of the wings on the sticky area and the other half on the Velcro. This technique will make it easier to remove at the next dressing change. Close the Velcro door. Next, peel off half the paper from the back side of the securement device and gently press onto the patient's skin. Carefully remove the other half of the paper and press on without contaminating your gloves. Using the supplied measuring tape, measure the length of the line in centimeters from the insertion site to the part of the catheter right before the plastic wings where the tubing size changes. If the line is out more than 2 centimeters from measurement at insertion, notify Fairview Home Infusion. Place the BioPatch blue side up, remember blue to the sky, with the slit parallel with the line encircling the central line. Ensure BioPatch edges are meeting. Note, if the patient has an allergy to chlorhexidine, do not use the BioPatch in the kit, as it is impregnated with chlorhexidine. Instead, use the Algidex disc and apply brown side down. Now place the dressing using the taco method. Bending the transparent film like a taco shell, note that the dressing shouldn't look perfect and it may have wrinkles. These dressings have memory, and if they are stretched while placing, the patient is at risk for skin tears around the perimeter of the dressing when removed. As the outer edge of the paper dressing is removed, walk your fingers along the edge and press to secure. Take the bottom portion, remove the backing halfway, and stick to the left side at the bottom aspect of the dressing. Lift tubing up and remove the backing on the other half and secure. This helps close the opening around the line. Be sure to add the date and your initials on the label provided. Measure the arm circumference now. Using the provided tape measure, measure 10 centimeters up from the antecubital space and measure the circumference of the arm, compared to the measurement of the arm on insertion. If a DVT is suspected, notify the prescriber and pharmacist. Labs can be drawn before or after the dressing change. At this time, if labs have been drawn, prime the extension, cut off the clamp on the extension prior to attaching to the line, clean the end of the line with alcohol, and let air dry. The extension set should be changed with every dressing change. If you put the cap on before the alcohol has dried, the cap can get stuck on the line. Attach the extension set and flush with saline using the push and pause method. Close the clamp. If using heparin, clean the end cap again with a new alcohol wipe and administer the heparin. Close the clamp. Reasons to call Fairview Home Infusion: if your dressing is peeling off or gets wet, if you notice that your line has migrated or moved, if you are experiencing any problem. Please call 612-672-2233 if you have any questions or concerns about your medication. We have specialty pharmacists and nurses on call and available 24/7. In the event of an emergency, always call 911. Thank you for watching this Fairview Home Infusion educational video. We welcome your feedback. Please like this video and leave a comment below.